Hello, I'm Dr. Ruth Roberts, your pet's ally, and thank you for joining me today. And I have got a couple of really cool things to show you. First of all, we've got our member area, our free members area with the holistic pet health protocols. So let me pop over and show you what that looks like. And what I'm going to talk to you about today is our gut support protocol. So if you're not already a member, it's very easy. You would just go to member login, sign up, and I'll put a link actually so you can register for the members area. But you'd go to our website, click log in, and then this will take you to your My Account page. And on this page, you'll see the courses that you already own or the courses that I have available if you don't. And this is the spot where our new paid member area is going to show up here in a couple of weeks. That's going to be really exciting. You'll have access to all of my videos, as well as transcripts, written transcripts, and then audio file download so you can listen to the broadcast like a podcast type deal. And then down below, and then I'll also be teaching each month on a different topic with a Q&A session and all that good stuff to follow. But at the bottom of this My Account page are the free holistic pet health resources. So we've got some videos, some PDFs, but this is what we've been talking about is my holistic pet health protocols. So when we click that, we end up with the same page, sorry. When you click that, you end up with this list of support protocols I've developed, and as you can see, we'll be adding more as well. So we've talked about the Keep My Pet Healthy protocol. If your pet has a relatively mild health issue going on, this may be sufficient to really get you started and get your pet turned around. So we've talked about the cancer support protocol, the liver support protocol, and then today we're going to talk about the gut support protocol. And as I've got down here, the gut is truly the basis of all health, and it produces, when it's functioning properly, 75% of the immune system function and 90% of the neurotransmitters. So if your pet's always had a sensitive tummy or more pronounced GI disease, this is the place to start. And then interestingly, if your pet has like autoimmune issues, cancer, things of that sort of thing, this is also a good place to start. And most people don't realize that. So autoimmune disease is the effect of the immune system responding inappropriately and attacking a part of the body. And so we can work on supporting the gut and improving leaky gut syndrome. And in that way, we can begin to get the immune system to respond more appropriately and help get that autoimmune disease back under control. Same thing with cancer. It's the immune system not responding appropriately. So the main three things that I want to accomplish with this GI support protocol is to remove, repair, and repopulate the gut. And so what that means is that we remove the things that are causing the gut irritation and problems, actually making that leaky gut syndrome get worse. We repair the GI tract by providing it the nutrients it needs to repair the enterocytes, repair the tight junctions, things of that nature. And then the last piece is to repopulate the gut. Now, probiotics have been around for a long time, but what we're starting to understand is it's not just reintroducing probiotics, but also the prebiotic fibers that allow those bacterial organisms to thrive and really kind of take hold and do what they're supposed to do. So first and foremost, if you're not cooking, start. Especially for pets with ongoing disease that just has been, a problem for months. There's been no solution. Medications that have been thrown in the mix, like antibiotics and anti-inflammatories, whether that's a non-steroidal drug or prednisone. It's so important to provide the gut with easy to digest food and in just really high quality foodstuffs. So, unfortunately, the commercial foods, even the really expensive ones, are made from highly processed foods, and that insults your pet's gut and keeps that leaky gut process active. So, I often talk with my consulting clients about making a rotation and elimination diet. And essentially, what that means is that we're going to create 3 different batches of food so that each day your pet is eating something different. And what this does is prevents the immune system from seeing the same thing day in and day out, and it gets the immune system to calm down and stop reacting to what your pet is eating. So that's step number 1. And along with that, we're going to end up removing a lot of the garbage that your pet's reacting to. We want to choose foods that it has not eaten in the last 6 months, ideally. And there's, the other wonderful thing is if you can do some sort of food sensitivity test, whether that's Dr. Dodd's NutriScan test or Glacier Peak Holistic's life stress scan. I've really become a big fan of that. That gives us a roadmap as to how we can take out the foods that may be irritating your pet and feed the ones that are going to be more sustaining, if that makes sense. Now, the second step is to reduce inflammation and strengthen the gut. So these are products I have used for a long time. Now, charcoal, activated charcoal, if you are starting to change up food and reduce inflammation and things of that nature, and your pet already has GI stuff, or even if it doesn't, charcoal is fantastic for adsorbing the things that make us feel cruddy. So both enterotoxins from bacterial die-off, as well as the substances that are produced by bacteria in an acute situation for diarrhea, things of that nature. Again, some of these are considered to be healthcare professional products, and that's part of why I have you log into this members area so that you understand that these are used for a specific purpose, and also so I can help kind of tailor what supplements might be best. Now, Icosamax TG is a really high potency omega-3 fatty acid supplement. And so to really make a big difference, you need to use a high dose of omega-3s. And so that's going to be somewhere between 25 and 50 milligrams per pound of body weight of omega-3 fatty acids. So for frame of reference, 1 teaspoon of Icosamax provides 2,800 milligrams of omega-3 fatty acids. Most fish oil capsules are 1,200 milligrams of fish oil, but they only provide about 270 milligrams of omega-3 fatty acids. So that's the big difference. 1 teaspoon of Icosamax is equivalent to roughly 10 capsules of most common fish oils. Now, HMF Multistrain 50 is a probiotic that I like to use specifically for pets that have had GI issues because it includes Saccharomyces boulardii, which is a yeast organism that is outstanding at getting the gut working more efficiently and overcoming the bad bugs and allowing the probiotic organisms to really take over the gut. So this has been a big home hit for many people's pets. Some of the other things we recommend are digestive enzymes. If your pets had difficulty digesting food, these are relatively low dose, so they provide just a little bit of assistance so that your pet's pancreas can still work and start to come back online, if you will. Shinling spleen support is a traditional Chinese veterinary medicine formula that's used to support the spleen, which is the organ associated with digestion. It also helps to dry up damp and helps to reduce diarrhea in the process of doing that. So damp is considered to be one of the anathema of the spleen, and that's, again, part of the reason why I think cooked food is the best way to go. The heartburn treatment sounds like, what's this doing in a gut health program? But really what it does include are things like diglycerized licorice, slippery elm, and several other things like a specific form of glucosamine that support the gut and help to grow and restore normal enterocytes or cells. So when these guys start growing, then the villi, the little finger-like projections in the gut, start to get repopulated with normal cells, and the tight junctions begin to close up so that your pet is able to absorb appropriately digested food and not kind of what's able to work its way down into the immune system. So this has been an awesome product. Pets generally eat it really well. Just it's a powder that you would just sprinkle on top of the food. So, and again, with all of these protocols, if you buy the entire protocol, you can save 10% off of everything. Now, the other thing is there are several in-home lab tests available that you can do, and you don't have to take your pet to the vet. So there's a couple of these. So I mentioned already the Pet Wellness Life Stress Scan by Glacier Peak Holistics. And this has been fantastic. It is a biofeedback test, not a antigen test. And what it does is look at over 300 foods and environmental toxins to see what your pet might be responding to. And frankly, I have found it to be as effective a roadmap as any other test out there. And it is so much less expensive. And again, it's something you can do at home. You would submit a small hair sample as well as take a cheek swab of saliva, drop those into plastic bags, send it off to the folks at Glacier Peak Holistics, and they will get me results back in about 7 to 10 days usually. You can combine that, and then I'll send you the results once we get them. If you need some help trying to figure out what to do with them, I have consultations available, and I can help you design a rotation and elimination diet based on what your pet is showing sensitivity to, and actually choose the foods that are likely to help support better. Now, many of you have been hearing about Animal Biome and their fecal transplant or FMT capsules. This has become a really valuable tool for many people because we can see what's out of whack with the digestive system for both dogs and cats, and then set up the diet to help support the good bugs as they're coming into the body, and give these fecal FMT capsules, which are essentially stool from healthy donor animals that provide the bacteria that's going to repopulate the gut and restore function back to normal. So there's a system for both dogs and cats. It's really worked extremely well. And then with the system, you will have a second test where you can revisit, okay, how are things looking now? What do we need to do to continue to support the good guys? So this has been a really profoundly effective tool. And again, we can combine this with a consultation to help guide you through this process. And then lastly, if you're more of a do-it-yourself person, I have a Gut Instincts course, and this goes through how to set up a rotation and elimination diet, several videos, and a whole bunch of information, so you will be able to understand what's going on and how to help protect your pet and get things moving. So that's the big stuff there. If you've got a quick question about how to get started, tailoring, choosing which supplements would be the best ones to start with for your pet, you can click here and we'll get back to you via email. We will get back to you with a few suggestions, and then if you've got a question that's relevant to a lot of other people, then what I'll do is actually answer that in one of these Facebook premiere videos or Facebook Live, so that everybody benefits from your question. And then lastly, if your pet has been having GI issues for a long time, a coaching program I think will be optimal for you, because it's going to give you specific details about what to do and when to do it. If if your pet's got really severe GI issues, kind of dumping all this stuff in at one time can be close to disastrous as far as the die-off and discomfort that he or she may experience. So this is a 2-month coaching program. We'll collect medical records and ask you to fill out a very lengthy intake form so I understand from your perspective what's been going on with your pet. We'll have a telephone call. I'll lay out a plan and a specific diet. We'll touch base via email in 2 weeks, and then have a second call 30 days later, and then another touch base email 2 weeks after that. And certainly if that's worked well for you, I've got an ongoing care program that folks have taken advantage of and have been really happy about. So that is the gut support protocol, and I am looking forward to you guys getting in more information about that and being able to start making a big change in your pet's health. So the other thing many of you ask me about is krill oil versus fish oil, and my own kind of perception of this is that krill are little shrimp-like organisms that are the basis of the entire food chain in the ocean. And shortly after krill oil became a big thing, they noticed that off the coast of Greenland that the krill population or biomass dropped by something like 30%. So the question is it really a better source of omega-3 fatty acids than the traditional fish oil supplements? And it turns out that probably not. So I'll post this for you so that you'll have this available to read. But there wasn't a big difference. So compared to fish oil, the difference was not significant in terms of brain health and things of that nature. And so there was no significant difference in the levels of DHA, but those in between the rats receiving krill and fish oils, but those rats receiving fish oil did show slightly higher concentrations of EPA. So that, I think that for what the purposes that krill oil is being touted, that a really good non or more renewable, let's see if I can actually switch back here, source of omega-3 fatty acids is a much better idea. And it's just, it's like a lot of things. It seemed like a good idea at the time, but it turned out that it really wasn't that much of a difference. And for the impact that we may be making on the environment, I think we're better to stick with a sustainable source of omega-3 fatty acids. And that's going to be something like anchovies, sardines, things of that nature. A lot of folks love using cod liver oil, and I get it. There is some increased vitamin A, which is important in winter. But again, this is a very large fish. So for instance, tuna, since America became obsessed with sushi, what's happened is that tunas used to come into the market at 400 pounds or more, and they're now coming into the market at 90 pounds. So what that means is that we are now eating juvenile fish, and we're severely overfishing many different species of fish. And this is going to become a huge problem going forward. So that's what I have to say. I think that, we've all been told, oh, you should only get wild-caught salmon and things of that nature. But the Monterey Marine Institute publishes a sustainable fish guide every year, and they're beginning to say that because many of the techniques used in farm-raising fish have changed to where it's cleaner, there's less impact on the environment, that farm-raised fish is a better option. So for instance, in grocery stores, if you're looking for trout, that's all you can buy is farm-raised. So check that out and take a look at it and see what you think. Now, we had several questions come in, which I'd love to answer. And the first one is from Brianna, and her dog Shaka has unfortunately become heartworm positive and had some weight gain. And so she wanted to know about the slow kill method for heartworm disease. Now, what that means is instead of using a drug called melarsamine, which is an arsenic-based drug that's injected into the back muscles of the dog, we're going to take it slow. So let me explain first how the melarsamine works. It is, again, an arsenical-based compound. The idea is that it will kill off the heartworms rather rapidly. It still takes about 6 months for all of that debris to clear. And additionally, for most animals, they do need to be on a couple of medications first. One is doxycycline. It is an antibiotic, but interestingly, it kills a parasite of the heartworm. Actually, we called it a parasite, but it turns out that it's essential for the female heartworm to be able to reproduce and lay the larvae. So as we kill off the Wallenbachia, we weaken the heartworm, and we also reduce the female worm's ability to produce offspring. That can create some die-off issues within your pet if they are already infested with the heartworm. And so for that reason, prednisone will often be used for a couple of months. Now, the other thing is, and there are some potential side effects as far as we're killing the worms. They actually live for the most part in your pet's lungs, not in the heart as you would think with the word heartworm positive. We had that as the diagnosis for 60, 80 years or more, but it turns out the worms actually spend most of the time in your pet's lungs. So as you can imagine, if that's happening, that can create some pretty nasty side effects as far as coughing, asthma-like symptoms. They feel cruddy, all of those things. So it's imperative that you be able to restrict your pet to a crate for 2 months. This includes no happy wiggle butt, no getting excited, or they'll have the potential for really nasty side effects to happen. So many people, and the other big thing is it's terribly expensive to have a heartworm treatment done. The last time I had to buy melarsamine in the practice, it had, for a drug that's been out for almost 30 years, it had increased in price by tenfold over those years. So it just, it's just not it's difficult. And so there's 2 reasons to consider what's called the slow kill method. One is, frankly, affordability. And the second is that your pet may be have severe heart disease already, or lung issues, or your dog is a serious wiggle butt, and restraining or keeping it quiet for 2 months is just not going to happen. Now, side note, in reference to cats, heartworm treatment in cats with melarsamine kills as many cats as it cures, so it's never been a good option. So we've always had to deal with the slow kill method for cats. Here's the sort of quick and dirty version of it. I do recommend using doxycycline because, again, we are going to weaken the female heartworm and make it so that she is unable to produce the larvae, which can create systemic reactions in your pet. But more importantly, it also allows other mosquitoes to pick up those larvae from your dog and transmit them to other dogs. So I think that is a very good idea. Most veterinarians, when they diagnose heartworm disease at this point, will go ahead and suggest something like that. And then the straight line, heartworm slow kill method is to simply put your pet back on heartworm prevention. And most often it is going to be an ivermectin-based heartworm preventive, because the milibemycin that's used in Interceptor and Sentinel can actually kill things too fast and create one of those reactions we're trying to avoid. Now, what else can you do? Because your pet's lungs are still trying to clear all of this garbage. And so certainly this is where high doses of omega-3 fatty acids, all the things I talk about all the time for controlling inflammation, are going to be important. So high doses of omega-3 fatty acids. You've also just given your pet an antibiotic, so we want to use probiotics to help rebuild the gut and prevent any long-term effects from those medications that may have needed to be used. And then this is where the homeopathic folks have got some awesome options. There are heartworm nosodes that can be used both for prevention and for treatment. My dear friend Will Falconer likes to use, making sure your pet's in the best health ever to prevent heartworm infestation in the first place. So those are all good options, Brianna, but talk with your local vet. Definitely do some doxycycline. The other interesting thing about doxycycline is it is an immunomodulatory drug, and I have used it for pets with autoimmune disease because it seems to help them resolve it more quickly. So that's the down and dirty options on heartworm, the slow kill heartworm method. Now, Jane wrote in about trace and angle with chronic skin and ear issues. And Jane, it sounds like you've got a real hot mess going on in your house. If these issues are chronic, again, the first place to start is in supporting the gut and getting it to work more efficiently. Likely you've had multiple rounds of antibiotics, prednisone, things of that nature. So I would start there, and then that's where the Glacier Peak Holistics Life Stress Scan test can be very, very helpful as well. And then I think you have to really sort of drill down into what's creating the issues. Is it a year-round issue? If so, then more likely that's going to be food or environment related as far as dust mites, molds, things of that nature. And then, or is it related to a particular season? And so if that's the case, then you can start to use things to help prevent the histamine release based on the pollens. So things like quercetin and stinging nettles. That's been just wonderful. Again, high doses of omega-3 fatty acids and probiotics. I've had several patients where all we did was give whopping doses of probiotics and their allergic disease resolved almost completely. So there is a terrific amount of power in that. So check that out. The other thing is with chronic ear issues. The reason that most pets have chronic ear issues is that first infection never got resolved. And what that means is that there's goo left in the ear. So the shape of the dog's ear canal is L-shaped like this. And at the bottom of this L is the eardrum. So if your dog has had chronic ear infections, often what's happened is that eardrum has popped open, grossness and infection has gotten down in there, and then it seals back over. You clean up the external ear canal, and then bam, 1 or 2 or 3 months later, that grossness in the middle ear explodes back out and reinfects the ear. So that's very important to make sure that your veterinarian is looking all the way down and that they can either visualize the eardrum or they can't. If they cannot and there's goobers and grossness sitting in front of it, that's really when flushing the ears out is going to be extremely helpful. In many cases, the eardrum can regrow, and if there's no infection sealed underneath it, we can resolve that ear infection once and for all. And there are other pups that, just that infection has gone on for so long that we're left fighting it. And there's a whole host of other options there. So, Jane, I hope that's helpful. And I'm sorry I didn't write this person's name down, but they were writing about Juno with terrific allergies, and she's tried pills and CBD and vitamins. Same idea. Work with the gut first, get that straightened out, and see if that doesn't start to help, and then go from there. And I'd love to give you more specific options, and I will have an allergy protocol coming up very soon. But really, because these are so specific to each pet, this is where a consultation becomes very, very important, whether it's with me or other folks out there. drilling down to the specific issues your pet is dealing with and looking at what's been done in the past is going to become extremely important. And then lastly, I had a question from Sarah about Rory, her cat. And unfortunately, Rory has a very advanced tumor, and the right side of the face has been quite swollen and numb. The third eyelid is popped up, and there's a big mass at the jaw and under the jawline. And her veterinarian examined Rory under sedation, but found that Rory's jaw is unable to move more than a half inch. And she's trying some steroids, and they're understandably not really wanting to go forward with biopsies and MRIs and things like that. So what she's looking for is a way to support Rory without going through all kinds of crazy hoops and jumps, and looking for food and herb suggestions. And obviously Rory's not able to chew anything because she can't open the jaw very well. So this is where you want to, I'd love to tell you the crock-pot diet's a panacea, but for cats it's difficult to switch foods. So whatever you can do to make Rory eat right now, and focus on high protein, high fat diets, and try to avoid carbohydrates. Although if you need them to keep Rory eating, do that. And the other thing is if you're having difficulty with eating, then talk with your veterinarian about appetite stimulants, because they can be really, really helpful. So find what Rory likes, mix that into a pate if it's not an already pateed type canned food. Crock-pot diet if your kitty loves chicken, a lot of times the starter recipe can be extremely helpful, and just keep them eating. So as far as that's the first step. And then what we have to do is layer in the supplements that are likely to be the most effective. So last week we talked about the cancer support diet. So again, the big bang supplements are going to be things like omega-3 fatty acids and probiotics. So choose one, make sure that Rory likes that, and then if she doesn't, then add in something else. But just start with one at a time, because the last thing we want to do is put Rory off food. And what I'd suggest doing is starting with a very small amount of food when Rory's hungry, mixing the supplement in with that, and then once that's been eaten, then giving the rest of the meal. That seems to help quite a bit. Now, as far as other things that are specific anti-cancer formulas, things like frankincense and myrrh type formulas are wonderful because they get things moving. This is considered to be a blood stagnation tumor. It sounds quite solid. So that's where that formula I mentioned last week would be very helpful. And then there's all sorts of other options like Coriolis, turkey tail mushrooms, Artemisia, and all sorts of stuff out there. But again, the important thing here is to start with one thing and layer them in slowly, so that we're not throwing a bunch of stuff into the food and keeping Rory from wanting to eat. At this point, and CBD oil certainly is another great option. So there's tons of them out there. We've used Cannabone's products quite often. They work really well. Pets seem to accept them well. And you can get a really concentrated formula, so you're only using a drop or so. Check with the manufacturer of the products for their recommendations. That's a great option, and that seems to have brought relief to many pets as well. So I hope that's helpful, Sarah. I hope that you and Rory get some benefit from that. Couple of other things to update you on. We should have the Mobility Masterclass recording just about finished. That was a ball doing that with Michael. So I'll put a link to that, and also to the place where you would need to go to register for the free members area, so you can get access to these holistic pet health protocols. So that's what I've got for you this week. Evidently, Facebook is being weird. I tried to do a broadcast with Barney Kunze with Animal Wellness Summit earlier today, so who knows when I'll actually get this video uploaded today. So many thanks to you all, and remember, until next week, your pet's best health starts in the bowl. I'm Dr. Ruth Roberts, your pet's ally. Thank you.